Well, welcome everyone. I am Ann Van Dunk, Assistant Executive Director of Milwaukee Habitat. I'm joined by Emily Neal, a member of our Global Partnership Committee, Vanessa Albanez, and Luis Vizcarra from Habitat El Salvador. I'm going to introduce them a little bit more in a moment, but one of the things throughout the COVID time that people have asked me is how are our partners in El Salvador doing? So Emily and I have been very graced during this time to spend some Zoom time with both Vanessa and Luis, and we thought this would be a great thing to record and talk about some of the things that we've talked about over the past couple months and how Habitat has been handling a lot of things during the same time that we are. So I'm going to start by introducing Vanessa, who is an architect and has been with Habitat El Salvador since 2014. She works in the Resource Development Department. So she is our link to sharing our impact and the 43,000 families that they have served with homeownership and repairs since their start. Luis has an undergraduate degree in computer science and an MBA. He's been with Habitat in volunteer management since 2012, and he works with both international and national volunteers. Emily is an architectural associate, currently employed with Quorum Architects, and has been involved in designing affordable housing in the Milwaukee area. She sits on our Global Partnership Committee as well as a member of HYPE and has led the trips to El Salvador multiple times. So Emily, do you want to kick our conversation off?
Yeah, thank you, Ann. So Vanessa and Luis, first of all, it's so good to see you guys again. Really happy that we can spend some time today to reconnect. So let's first talk about how COVID-19 has affected families throughout the country, in particular the Habitat staff, the Habitat El Salvador families, and just everyone personally. Maybe start with how long quarantine was for you guys and sort of just the country situation.
Okay, hi everyone. Thank you for this opportunity to be able to share with you our experiences. For Habitat El Salvador, this year has been unique. And in our country, we started like a national quarantine since March 12th. And then we had a lockdown since March 21st. So we had to stay at home since that day. And only companies or basic services stores were allowed to keep working. So for example, we as Habitat El Salvador, we were not allowed to keep working since that day. So all of our offices had to be closed and everyone had to stay at home working from home. It has been quite an experience because we had to learn how to do that, even though it might sound funny, but even though we had a computer and internet and everything, we really, as an organization, had to learn how to work from home. And I think it depends on the situation of every person because it depends on who you are living with. For example, if you have your family and you have small children, it would be more difficult. Or if you are alone at home, you might think that it was easier, but it was, I think, difficult too, because being alone all the time can make things more difficult sometimes. So my own experience as a mom, I have two small children, one 6-year-old daughter and one 4-year-old son. Working from home was a challenge. I suddenly became a full-time work mom. teacher. I became the cleaning lady of the house. I had to do a lot of other things too, cooking, doing the dishes and the laundry. So at first it was like a mess for me. So I had to learn how to organize not only the work time, but also the time for my family and the time for my other responsibilities. So it has been quite difficult, challenging, but it has also taught me that this time with my family has been very important because at the beginning we needed to go out, for example, to the supermarket, but we couldn't just go out. We needed to have our ID. And the first weeks of the lockdown, we needed to see the number that we had on our ID to go out a specific day. So in my family, what we did is that I always stayed with the kids, and it was my husband going out to the supermarket and doing all other things if needed. And it was just go out the house to do that specific thing and coming back to the house. And of course, when you got home, you have to have this protocol to be cleaned before you can actually start doing other things at home. So I think it has been difficult in general for every family. If I can think about our Habitat homeowners, for some of them, it has been a different reality, more difficult reality, because at least I could stay home and I have a job and I have been receiving my salary every month. That has been a blessing too during this time because not only in El Salvador, but I think in every country, there are a lot of families that have lost their income, and it has made them put them in a very difficult situation. So for Habitat homeowners in El Salvador, most of them are don't have a formal job, so they are in what we call the informal sector. So if they can't go out their house to sell things or to do things to have an income, they don't have it. So for most of the Habitat homeowners, it has been really difficult not to have the income that they normally have during all this time. So we had this lockdown up to mid-June, and then things started to reopen again. But I think that for the families in general, it's going to take longer to be able to have everything that they used to have before the pandemic or the lockdown here in El Salvador.
Yeah, and how was it, getting the essential products that you needed throughout this time, and for the homeowners too?
So it was barely just like the supermarket open, so you could go there. But for example, for most of our families in different places of the country, the markets were closed because they didn't have all the measures to prevent or to protect the families to be infected of the virus. So they were closed, and you had to go to the supermarket to be able to buy things, which are more expensive than in the market, in the local market. So basically, for most of the families, they didn't have the local store open to do that. So it was also a very difficult situation.
Yeah, and one thing that was brought up earlier was, the idea of the frozen mortgages. I don't know if you could expand on that at all.
Mhm.
Is that my line?
Yeah.
Well, thank you for asking. Well, Habitat is, in the case of the country, the president did give a mandate for organizations to start freezing mortgages in order to assist families. Habitat El Salvador took it a step further and extending it to any family who needed it. of ours, even if they were working, but if they weren't doing so well, we just extended it over. We also did it a lot longer than mandated by government. That basically was a way of supporting our families so that if they couldn't pay, they didn't have to. Uh, no type of penalty was incurred. We just passed whatever that period was as long as they needed to the end of the mortgage. Um, During the peak of the quarantine, I think repayments in Habitat went down something like 70%. So it was a lot. But we powered through it.
Yeah. We also wanted to talk about the educational system and how maybe Vanessa, you can give some insight to how you've been able to teach your kids throughout this time.
Okay, so in my family, the school where they attend, everything is virtual now. So they are having virtual classes since March. And it has been also a challenge for us as a family because, of course, we needed to have good internet so the children can be connected. We needed to have computers or other devices so they could be each one of them with their class and the teacher. So I think that for my family, it has been a privilege and a blessing to be able to keep having education for my children. But it hasn't been the case for most of the families that live in rural areas or other parts of the country that don't have all these basic needs that right now in this situation are really needed. So some of the students, they couldn't go to the school, of course, because everything was closed. So they needed to maybe connect through their parents' cell phones to have internet. Some of them couldn't even have that service at home. So the education ministry, they also had a challenge for our country. So there is a national TV specific channel that they started to kind of giving virtual classes for all of the public schools. So if these families had a TV in their house to be able to see the classes, then they were fine. Mhm.
Interesting. Luis, can you maybe talk about some of the measures that were implemented by the government, and if you have something similar to unemployment, and maybe just also touch on some of the risks of quarantine, especially for those living in rural communities?
Sure, I'd love to. As Vanessa mentioned previously, there were regulations in regards to how you could go out. A lot of it involved, like we use a unique ID system. It is required by law. Everyone has to have it. You vote with it, and the first time you get it, it's free. So in that sense, it's your one identifier, and the government is required to give you it, and you're required to take care of it. So they basically use the last digit, which is numeration 1 through 10, to identify which day you were allowed to go out. And that's it. Most businesses were closed, so there weren't that many options you could go to, but it was also a challenge because public transportation wasn't running either. So if your area was not close to a supermarket, which most rural areas aren't, you have to spend a lot more money to get to the supermarket. Markets in itself that are very community based and kind of serve the community as well were not allowed to function. A lot of people just had to take their chances and go out into the streets to sell because their income was not enough. The government did provide relief in the form of food packages that they were delivering across the country. It faced challenges initially, and the need was very great. So hands off to the government. It was a logistical nightmare that they had to deal with. In that sense, that part was good. Regulations were very strict. Like if you had to go out, mask was absolutely required. You could not go out if your ID was the wrong one. And it was complicated because there were people that had real life emergencies that they had to attend to. Maybe not a COVID related emergency, but if someone had an ill parent, an ill child, they had to go out. They also used a very much, I'm not sure if I'm allowed to say this, like fear mongering system in which they very much basically created containment units, I will call them that, in which anyone who was caught outside their defined date would be put in with everyone that has COVID. So it was a way to kind of force everyone to have to follow the mandate. But again, everyone that was going out was people who couldn't afford to stay home. In rural areas, it was particularly difficult. There's this case of a lady that she was quite literally helping her kid cross the street to the bathroom because they didn't have an inside bathroom, which you would think is something that most people do, but they don't. Police caught her. It wasn't her turn to be outside, and she quite literally got sent to COVID jail for taking her kid to the restroom.
And how long are they typically there? I mean,
they were there with that. They were basically detained without rights. So they were there until the end of the quarantine.
wow. And that, and I'm sure that similar things have happened all across the country. Are there other areas or just other measures that the government implemented that you can talk about, or?
The strongest ones were definitely related to public transportation, limiting business activities. People were almost exclusively working from homes. Emergency services were basically, I don't want to say canceled because that would be inaccurate, but they were only attending the most extreme of the cases. So if I were, for hypothetical, like I broke my tooth, I need to get that fixed, that wasn't an emergency, gotta push through. I was having a heart attack, then yes, I could go to the hospital. Yeah. But then you also risk going being quarantined with everyone else because you were at a hospital. So there was a significant risk factor in regards to mobilization. And even with the ID system, there was another regulation that only one family member could go out per group. And it was kind of up to whoever stopped you if they believed you or not. So let's say, for example, if I was in an affluent area and the policeman stopped me, they'll probably buy it and say, like, yeah, you're probably free to go. But if I was in a more rural area, they could easily say, well, I think I saw you go out twice this week and you're not allowed. So they take you away.
Wow.
Sure.
So one thing that we had here in the States was sort of the, what businesses could open first, just as more of like an essential service. And maybe this leads into your topics, but just wondering how Habitat has been working. And Anne, if you have any further questions.
Well, I think, Vanessa, you talked about the very beginning working from home. How has that transition happened to then partially working in the office and then also on, those people who don't work in an office for Habitat El Salvador? How has that worked for those staff members?
So we started coming to the office 1st of July after the lockdown was over. So we had like a protocol to start working in the offices again. So we had different phases. Like, for example, phase 1 was only 25% of the staff in the office and the other 75% at home. We started with building activities, but it was mostly the houses that were on hold before the lockdown because we had a lot of houses in the process of being built. So we needed to move forward with that. And we didn't start with like new houses or new families at that moment. Then phase two was 50% of the staff in the office and 50% at home. And of course, we have a protocol too here in the office. Every day that you come, you have to wear a mask. You have to, they measure your temperature. We have things on the ground so you can kind of clean your shoes. And everyone that comes needs to follow all of these measures. And at first, we didn't receive any external persons in the offices. The regional offices that are in contact with the families, they couldn't receive families in July. I think they have started receiving families in October. So we had all of these measures in the offices to be able to start working again. And right now we are 75% of the staff in the offices and 25% at home. So we don't come every day to the office. We're just some days and in different days. So we have all of these measures to be able to protect ourselves and the families from the virus. And for example, on site, if we are building a house for a family, there we have also protocols that need to be followed by everyone, by the masons, by the families, by the supervisors. So everyone that goes into the site, they need to wash their hands. We have sanitizers. They have to wear a mask. I'm not sure if they are measuring all the temperatures for everyone, but we have been talking to the families about all of these protocols because it's important for them to understand that we are protecting them from us or from the staff, and also taking care of them, you know, so it's protecting all of us in the process.
So can you share a little bit about the unfortunate need to downsize and how that affected your staff in general?
Yes. So for Habitat El Salvador, it has been really difficult to manage all of the staff that needed to stay home without being able to do the job, you know, the responsibilities. So for example, we have, since we are not receiving international teams, all the people working in that department had to do other things. Of course, we have a lot of things to do, but there were some specific responsibilities that we couldn't do from home. And not only them, but other job positions that we have in the organization. So I think that, and it happened all over the country with different companies and organizations, they had to downsize the staff. Some of them did it in the beginning of the lockdown. Some of them are doing it now. For Habitat El Salvador, I think it was a very difficult situation to have layoffs. And it was people that we know, people that we've been working with every day. And it's not very common here in the organization to have people let go. So it has been very difficult. I think most of the persons, even though they might understand why it happened, it's a very difficult time for them, for their families, because we as a country don't have like a support that goes automatically because you lose your job. We don't have that. So even though they might have received an amount of money, you know, as the law says, but not having a job right now might be very difficult for some families. So it has been difficult for us, for the staff that comes to the office and we don't see everyone here. It's been really difficult. It's been a very difficult year. I'm sure that it's been difficult for the persons taking those decisions. But I think that since it almost never happens, I think it made things more difficult than in other parts.
Emily, do you want to go into the housing construction?
Sure. Luis, could you talk a little bit about any changes that you've made or seen as far as at the construction sites? You know, are there times of how long it's been taking to complete houses? You know, is the work of, do you have volunteers that are still out there? Is it mainly just families now? Kind of elaborate on that.
I'd love to. We definitely have to adopt protocols, same as Vanessa mentioned. Same things that are happening in office are happening on sites. Everything from taking your temperature before your shift, at the end of it, midway, using hand sanitizer like you're left dependent on it, mandatory masks. And you do not want to be building in the heat with a mask, but you know it's better than dying, so we do that. So yes, we are definitely following guidelines. There has been a significant reduction in the amount of people that are allowed per site. Our maximum right now, and this has been validated by many organizations, is 6 per house. So there is not a lot of space for volunteers. That was a particularly difficult choice because volunteers are at the core of what we do. But both Habitat International said, well, this is not the time to be sending people overseas, and that is the right call. I am 100% behind that. And something that we want to be consistent with is the message that we're sending to our international partners and our national partners. If we're saying, well, you can't do this over here, well, same thing applies for our national volunteers here. If we're not going to follow all the guidelines, then we can't really take volunteers out to build. It is in the plans. It is eventually going to happen once we figure some things out, mostly logistical, in regards to cost, because if we want to keep all the conditions, moving volunteers is still very tricky. It's still very early in that phase for us. But it's hit us in 2 fronts. One is in the construction part because building is taking longer. But the other one is just really in regards to our image as a nonprofit. Right now, we're just building houses. The social component, which is volunteers come, they help, they aid, like they were the face of the organization. We've kind of lost that for now, and that's probably the area where we've been hit the most. There is still work to be done. There is work to be done from home, virtually. Again, that's kind of the only way that's allowed, but nowhere near enough work to keep the level of engagement that we were used to.
Yeah, and the volunteers that you do have out on site, are they mainly related to the families and that's why they're more so permitted, or? Right
now, there are no volunteers on site. The only people that are on site are families and masons.
Yeah.
So no, the constructions are getting behind.
Has there been a change in the number of masons that you have, or has that remained pretty constant?
That has remained pretty constant. If we put in more masons, that increases the cost of the house. It's kind of a pull and tug situation. If there is a right answer, we have not yet figured it out.
And we have also kind of implemented new things for the masons, for example, because since at first when we started building again, we didn't have public transportation for everyone. So we had to take the masons from the office to the site sometimes. Also because after that, after the public transportation started again, we are also taking all of those measures, not only for the Masons, but also for people that goes to the offices, so they don't have to use the public transportation because it's a high risk to be infected by the virus in that environment. So we as an organization are trying to take other measures, and it's of course increasing costs, but we think that we need to do them because we need everyone to be safe and healthy.
Mhm.
So from Luis, you talked a little bit about the government's response in the beginning. Has there been changes? Are the borders still closed? Do you have the ability to be tested for the virus if you want at this time? Or how are, you know, how is that?
Well, borders are opening. You're allowed to come in, you're allowed to go out. If coming into El Salvador, you need to be tested prior in wherever country you're coming from. You need to be able to prove that you have the test, otherwise you're not allowed in. There have been some logistical complications because when they regulated that, when they put that in, they kind of didn't let anyone know. So people showed up at the airport without a test, so they were like, "Oh, you can't travel." So we could have done better on that part. Tests are available in the country. That is a good thing. If you at any time think that you are sick, there are many locations where you can just go and get tested. Testing times in regards to when you get the answer, that could take a little bit longer. It's mostly related to capacity of how many people we can test at a time. Government response has been mixed. I think that there have been really good initiatives like pushing for masks, pushing for hand sanitizer, keeping protocols in regard to public transportation. That's been very useful. There aren't any mandates. Our government and our assembly, basically what our equivalent of the Senate and the House of Representatives, do not get along. So getting them to do anything is quite of a challenge. Right now, the country has no declaration of an emergency because of COVID-19. Everything that we're doing is basically mandated recommendations, if that makes any sense. Like for businesses, there are conditions in place, but there is no penalty if you don't follow them. One of the biggest factors in actually fighting COVID-19 for El Salvador has actually been that people are very aware of the risk. Like most people in the streets, like I'm not going to say that there aren't people with masks that don't choose to, but the grand majority of people are doing it. Most people are avoiding gatherings. I think Christmas is probably going to be one of our more challenging times. It is a very much family-centered, gathering-centered type of the year. So it's, if anything does peak, it's probably going to be around that time. Regulations would help, but apparently we're not doing that.
But what would be peak? Like your numbers in the whole country have been incredibly low all through this, correct?
Yes.
Even our bad numbers is
More than
well, most of the population that had it has already been cleared. They're already back home and immune. But again, even if that's the case, mask is still a requirement. It still should be a requirement. Sure. One of the fears is that it will strain the capacity of our healthcare system. It's not as much as an issue that there isn't capacity installed to attend COVID cases, is that our healthcare system was already pretty strained even before COVID. Hospitals were always packed. The service wasn't great, not because health workers weren't giving it 100%, but simply because the sheer amount of people they had to take care of, it was just unrealistic to expect everyone to receive a full treatment. Hospitals were doing the best they could.
Mhm.
And also, I think that sometimes we might think that the numbers that like the official numbers are not like real, because there is a site, you can go to the website and see all the cases, the deaths. But I think that there is a sense that those numbers are not like real, and that we have more, a lot more than what we can see there.
And that's probably the case.
Yeah.
Is there anything else that you'd like to share regarding, working from home, or how the affiliate is responding, before we move on?
I think that with this pandemic and this situation, we that work for families to have an adequate housing, we understand the importance of a house, adequate house, on regards of materials or the size for all of the members of the families. So I think with this pandemic, with this situation, with this virus, we can see other organizations or other sectors of the society that really are seeing the importance of housing, adequate housing, which is good, because even though here in El Salvador, we have a very high housing deficit, we don't have a policy that that has been for many years. We have processes, we have a draft, we participated in that as an organization, and we have given it to the government, but it's just something that it's starting. So I think that right now, not only organizations like us that work with vulnerable families, but also other sectors of construction, they are thinking about this, like designing of the houses maybe need to change, because this virus is not the last one that we're going to have maybe. So we need to be prepared for that, and I think that we need to think long term. So this pandemic, I think, has changed us in many ways, in different ways. And also, I would like to add that even though it has been really difficult, my personal experience, I have felt sometimes that I'm in a chaos at home, trying to work, trying to have my house clean, trying to have the food done on time and everything. But I have felt really blessed to be able to stay home with my kids, to have them protected there, to have everything that we need. And it has given me also a different perspective on what quality time for my family is. Because now I don't have to spend 2 hours on traffic to go to the office and come back every day. I can stay home. I have more time to be with them. So I think that I would like to also point that out, because I really believe that there is always something positive and good out of something bad.
Yeah.
So my personal experience has been that I feel really blessed to be able to stay home with my children, to see things that I can't see when they are at school, for example, to see how they are learning, how they interact, even though they are doing it through the computer, which is different. And of course, they feel like some things are going to be the same, and some things are going to be so different when they go back to the school. But I can be there with them, and I can see those little details that are very important for me as a mom.
Yeah, it's so great to see some positivity coming out of of this. And, we just wanted to also ask, what are some moments of joy? And if you have any stories that you wanted to share, these are really hard conversations to have earlier, but, oh, my cat is coming into the screen. But, little moments of joy, like being able to work with your pets from home, that's one of mine. And so please, if you have anything to share, we'd love to hear.
Well, I live very close to my folks, so I ended up staying with them for most of the quarantine, and it was a very nice dynamic. It was a very interesting change in pace, just to be able to see your parents every day, talk to them. We had every meal together. Like we made it an occasion. We took turns to cook, and by take turns I mean my mom or my sister, because I can't cook. Well, I did maybe one during the quarantine, maybe. I don't remember. Yeah, just having those times to share, I think it made it a lot more valuable. We had quite a few birthdays actually during the quarantine, and it ended up just being the four of us, maybe five if an aunt did drop by. But again, it made it very intimate. So those little spaces to share it made them that much more special. The fact that that was your group.
Yeah. For me, it has been breakfast. Before the pandemic, we needed to go out our house very early in the morning. So we always had breakfast in the car, like going to the school or going to the office. So right now I can sit with my kids, with my husband, and have a breakfast as a family. So for me, that has been very important because I can start my day with them, and we can have all the meals together, even though sometimes it's harder, but but at least we can be there together to have these moments with them. And this is important because I think that it's going to make things different after this. We maybe are going to keep those moments for us as a family. So I think that has been very important for me to have breakfast with them.
So one of the big other questions that I get is, how can I support El Salvador Habitat from here? Especially during this time when I can't support it by coming on a trip.
Yeah. Well, I think that one easy thing that everyone can do is follow Habitat El Salvador on social media. So you can keep track on everything that we're doing. You can also subscribe to our newsletter so you can receive information on what we're doing. It might not be everything about COVID, but other things that we're normally doing too. And of course, I would encourage everyone to keep supporting Milwaukee Habitat for Humanity. Keep connected and keep contact with your local affiliate, because at this moment, everything that you do to support them, you are doing to support us. So go to the restores if they are working for everyone. So go buy things and invite other people to do that, because with this kind of support, you are supporting Habitat El Salvador directly.
Yeah.
So Vanessa, do you want to give a little update about our tithe numbers and family?
I do. I'd love to. So I think that even these kind of conversations is part of this special partnership that we have with the affiliate. And not only with Milwaukee Habitat for Humanity, but also with the Habitat Young Professionals, because all of the support that we have received from the affiliate since, I have data from 1999, and then since 2005. So we've been receiving your support for all of these years. And it's not only that you send economically support or tithe or donations, but it's beyond that. It's about partnerships, it's about relationships, it's about friendship. Um, we are sharing with you not only how this has been affected our work, but about our families, our personal life. So I think that these numbers are also reflecting that. And I'm really happy to share that Milwaukee Habitat for Humanity has been tithed to El Salvador, and we have received more than $1.2 million all of these years, which is amazing. Milwaukee Habitat for Humanity is one of our key partners, not only because tithe, but because the strong relationship and partnership that we have. We can be in contact through emails, we can receive teams, but we know that we can count on you. And that means that we've been able, as Habitat El Salvador, to partner with 172 families. So because of your support, because of everything that you've done all these years, we have been able to change all of these families' lives. So they now, I'm sure that they now, with all this pandemic situation, have a different life. They can be protected in their habitat house, and it's because of you. So you are part of this too. So thank you so much for everything.
So I would add that if anybody wants to give directly to Habitat El Salvador, the way to do that, we send a check every month. And if you want to give your donation directly to Habitat El Salvador, you give to Milwaukee Habitat, and we will, and with the designation that 100% should go to El Salvador, we will add that in addition to our tithe. Do not write Habitat El Salvador a number of reasons. If you have any questions on that, you can call me and I can explain that. I did want to also say that one of the major things besides going on trips for us has been this kind of partnership we have that is not just friendship, but if somebody says, hey, I want to figure something out, I often might point them to Charlotte Habitat, or I might point them to Dane County Habitat, but I often say, check how El Salvador does it, because they are doing things really well. So we have always had this very tight kind of partnership that has gone on beyond just coming. That said, we just cannot wait until we are standing under that sign that says, welcome to El Salvador, and we look forward to that. So this time has been invaluable. Thank you so much for updating us. Perhaps if this vaccine does not come soon enough and we have more to talk about, we will do this again before we can come to El Salvador. But
we definitely love to. Again, at this time, priority is taking care of yourself,
Yes.
taking care of your loved ones. So we are more than happy to wait.
Yes.
Well, thank you again. This ends our conversation.
Thank you.
Thank you.